bean-shaped kidneys together receive around 25% of the blood pumped by the heart because it filters blood employing small filtration unit, nephrons, to remove toxic waste. Inside the kidney, the outer deep red part, named cortex, is rich in blood capillaries, and blood is filtered by nephrons, Bowman's capsule in the cortex. The inner part, the medulla, is pale, and this pyramid-like renal pyramids have bulk nephron tubules which carry the filtrate liquid. After reabsorption of essential materials in tubules, the liquid that reaches renal pelvis is urine. Ureter originates from renal pelvis. Ureter carry it to bladder for storing until the person urinates. Thus, kidney processes around 180 liter blood per day, producing 1 to 2 liter urine, assuming you drink minimum 3 liter water per day.
We have seen a video of the kidney and how the kidney works. We have noticed that actually a number of things that happen, but I think Dr. Kaliswa will be in the best position to explain when you talk about the kidney and kidney disease. Give us an overview of what we're talking about.
Yes, as we have seen from the clip of the video, the kidneys are actually two organs. Every normal person normally has two organs of the kidney, which are located at the elbow length, and they are usually the size of a fist. So those kidneys have tubes, which we have seen. They are called the ureters. They are also two. Those tubes come through the node of the beans, and they actually go down and connect to another reservoir, which is called the urinary bladder. And then the urinary bladder is able to connect to the outlet where the urine is able to pass. So those two kidneys are supposed to help the body doing very important things, particularly clearing the blood of toxic substances.
Okay. So under normal circumstances, our bodies produce substances that are cleared by the kidneys.
Yes.
Okay. So what can go wrong?
Many things can go wrong as the structure has been shown. You can look at the kidney as a meshwork of very many blood vessels.
Okay.
And those blood vessels come together and they form a functional unit of the kidney, which is called the glomerulus, or largely called the nephron. In that nephron there is a filter, and whatever is filtered through that filter brings out a filtrate, which is the final product. So that final product has to go through those small tubes, and then it ends up in a very big tube called the pelvis, which then joins to the ureter. So along that process, anything can go wrong. So things that can affect the kidney can be before you meet the kidneys. Okay. That is basically what we call pre-renal, or before the kidney itself. Generally, when the body has had problems, they can happen within the kidney, which is called glomerular or intraglomerular. and then they can happen after the kidney. So usually before the kidney has to receive about a quarter of the blood that goes to the whole body, as we saw in that film. 25% of the heart output, cardiac output, has to
go through the kidney.
To go through the kidney every time the heart pumps. So if there is any problem along that path, the kidney will definitely be affected. And then when it comes to the kidney itself, it could be through the glomerulus, it could be through those small tubes, or it could be actually through the spaces between those small tubes. And then lastly, it could be after the urine has been produced, and then it gets obstructed by either a stone, which can be in the ureter, or by any problem along the bladder and the urethra, which is where the urine passes out.
So urine is formed in the kidneys.
Yes.
Those things we talked about, nephron, etc. It comes into a collecting tube.
Yes.
And then drains into a bag.
Into a bag.
The bag is the kidney. No,
the urinary bladder.
The urinary bladder.
Yes.
And then it goes out of the urinary bladder through a smaller tube called the urethra.
Yes.
And anything can happen before the kidney. In other words, you may have a situation where there's no blood going to the kidney.
That's true.
Or you might have issues after that, right?
Yes.
And you can turn into disease.
All those can turn into a disease.
Acute kidney injury and acute kidney failure. How different are those?
So acute kidney injury is actually a term that has been used over the last 7 years to describe, to try and focus in a better way what we used to call acute kidney failure. When you say acute kidney failure, it means that the kidney has actually failed and there's nothing it can do.
Oh, so acute kidney failure is an old term?
It's an old term. It's actually the final stage of acute kidney injury. Because with acute kidney injury, what happens is that it occurs in stages. The kidney can be affected, like if your blood level reduces, the kidney begins to get injured in stages. So the first stage, it might not be receiving enough blood, but it's doing some work. Then in the second stage, maybe the glomerulus or those tubules, those small tubes get damaged. And then in the third stage, which is actually called the kidney failure, the kidney fails to do any of its functions. Maybe those are the ones I should talk about.
Yeah, you should talk about that.
Yeah. So really, as I said, we have two kidneys, and the major kidney function is actually to ensure that it removes all toxins from the body. It does that by clearing about 180 liters in 24 hours of the toxins that are made in those 24 hours. And as it does that, it forms that fine filtrate, which turns out to be the urine. Actually, the major byproduct in urine is actually urea. That's why you call it urine. And then there are other toxic substances that come out. So it clears the body and balances it, balances the water. One of the other functions of the kidney is ensuring that it keeps the internal environment of the body in balance, which we commonly in science call the internal milieu. It's like when you are going to cook, you have to make sure the salt is well. You have to make sure if you are putting pepper, it is also balanced. You have to make sure if there is an ingredient there, it is in the right amount. The kidney is the one that fine-tunes what we call the electrolytes. The kidney is also important in controlling the blood pressure. It does so by producing small messengers, which we call hormones, that go throughout the body. They are sent to the heart, they are sent to the blood vessels, and in so doing, they are able to ensure that the blood pressure is maintained in the normal limits. The other thing the kidney does, it produces another messenger, which we call erythropoietin, that stimulates the bone marrow. Dr. Dung, you are a hematologist. That stimulates the bone marrow to actually form blood. So the kidney is very, very important and vital in the production of blood. The other thing the kidney does is actually to ensure that your bones are kept strong by it helping the absorption of an element called calcium, which is the major component of the bones. So it helps to control the vitamin that actually helps to absorb the calcium which is later, through several processes, is incorporated into the bones. So the kidney is able to do all these jobs, and it does a lot of other things like helping to control the sugar, but those I've mentioned above are the major functions of the kidney.
This organ that is doing all that, how big is it?
Actually, the kidney, as I said earlier, is the size of your fist.
Like
but
this?
you have two, yes.
Eh,
They are quite small, but some people have said that the most intelligent organs in the body, besides the brain, are actually the kidneys.
Very, very intelligent.
Yes.
Indeed, for some of you who have just joined in, this is UBC TV and it is UHealth Chat. I'm Dr. Dungu, and with me is a special guest, Dr. Robert Kalyasubula, who is a kidney specialist and indeed president of the Uganda Kidney Foundation. So we are talking about kidney diseases or kidney health, and actually we want to really focus on how we can keep away from kidney diseases. But before we do that, how does one know they might be having kidney disease? What are the symptoms?
Yes, that's a very important question, Dr. Dung. So the greatest challenge we have as kidney specialists is that the greatest symptom of kidney disease is nothing.
What do you mean nothing?
Most people with kidney disease have no symptoms. So the symptoms of kidney disease only come after the kidney disease is advanced. You know, when you get malaria, you get a fever. And when you get the fever, you know you are sick. When you get a heart attack, you get chest pain. But unfortunately, when you get kidney disease, there's usually no symptom. And the kidney falls sick in about 5 steps, which we call the 5 stages. So, and this can be equated for a child you send to school and how well they score in their marks. So if the kidney scores in its function, the work I explained above, it scores 90 and above, you say that person is probably having, if they have an abnormality, they have kidney stage 1. If it is scores 60 to 90, they are stage 2. If it is scores 30 to 60, they are stage 3, and 15 to 30% of its function is 4. And when it is less than 15%, we say you have kidney failure, which is actually called end-stage kidney failure.
End-stage kidney failure is when you have less than
15% of your kidney function. So most people begin to get symptoms when your kidneys function less than 30%. So all above there, people might be doing their normal things, but they will probably want to know. So once the kidney gets affected, then part of its work can begin to get affected. Most people usually present with body swelling, because that's the major function of the kidney, to produce urine and take out the water. So when that water is not taken out, it begins to accumulate in some parts of the body.
And the body swells.
The body swells. Normally people have swelling in the body, which usually occurs in the legs, or they notice that when they wake up in the morning, their face is swollen. And as the day goes by, the swelling goes away because the water goes to the lower parts of the body. So that's one of the commonest presentations of kidney disease. But they might also notice that they are producing less urine. Normally a person is supposed to produce 1 to 2 liters of urine per day if they are drinking enough. But if you are producing less than 500 mils of urine in 24 hours, which is a day, then you might have a kidney problem. The other presentation largely depend on what caused the kidney disease. For instance, you might find that some people are passing very concentrated urine, or they are passing blood in urine. If any of those blood vessels we talked about is damaged,
you can have blood into
you can actually have blood in urine. Others might have pain when they are passing urine, if part of that system is affected, like when they get urinary tract infections, so they might feel like they are getting pain when they are passing urine. Others might get very severe pain if along that path there is a stone or anything else that has blocked the path of the urine. The urine flows back up and it can cause a lot of pain. People can present with back pain, they can present with loin pain, and then at times if they end up getting very severe kidney disease, actually almost every problem can happen in the body, but largely they present with lack of appetite, they present with weight loss, they present with skin itching, they can actually go mad.
So that is irrespective of whether it's acute or
acute or chronic. Those are usually the stages it goes through. And we use we use some markers in the blood, mainly creatinine and urea, to be able to decide the stages where we are with the kidney disease.
No, this scares me. Is this a common problem?
So the kidney disease problem is
In Uganda
it's actually common. World over, for adults, every 1 in 10 people have a kidney disease. And for Uganda, people who have mild kidney disease are actually 1 in 5, 20%.
You know what? People are so much interested in knowing how common this is. We'll take a short break. And when we come back, we're going to continue the discussion. But as we take this break, let's look at some of the golden rules on how to keep our kidneys safe when we return.
Three. What's up with number 3? It's 3 at Airtel and not 4 anymore. It's 3 shillings per second across all networks in Uganda.
Make calls from Airtel to all networks at 3 shillings per second. Get to talk to anyone on any network anytime at 3 shillings per second. Ha ha!
Airtel, the smartphone network. Airtel is regulated by Uganda Communications Commission.
Welcome back. It is U Health Chat. I'm Dr. Dungu, and with me is Dr. Robert Kalisubula, a specialist in kidney and kidney diseases. We are talking about kidneys, and you've seen the ways you can prevent your kidneys from getting sick. I hope you can keep going through all that so that you prevent your kidneys from getting unwell. Dr. Kalisubula, before the break, you're talking about how common kidney disease is, especially in this country.
So kidney disease is quite common, but it largely depends on the stage at which you define it. About 20%, 1 in 5 people, have some form of mild kidney disease. We did some studies from Wakiso, and we have done some studies from Cham River, which have actually demonstrated that. But for the people who have chronic kidney disease, which is a function of less than 60%, we found that actually about 2%, 2 out of 100 people actually have chronic kidney disease. And that's a big trouble, as we are going to be talking about it. Yes.
Wow. What causes this?
So
and who is at risk?
Yeah. So for the purposes of this talk, I'm going to mainly focus on chronic kidney disease.
Okay.
So for acute kidney disease, CKD. So the acute kidney disease has many causes, but that one is usually treatable if it is recognized that it's chronic kidney disease that is ubiquitous.
Again,
because
when does it become chronic?
If you have had abnormal kidney function for beyond 3 months, then you are considered to have chronic kidney disease.
Okay.
Yeah.
Okay, go ahead. How do you know that?
So
who is at risk of getting
so
that?
the most common person at risk of getting kidney disease in the world is a person who has diabetes. Diabetes is the commonest cause of kidney disease world over, whereas in Uganda, hypertension, high blood pressure, is actually the commonest cause of kidney disease. People will ask which one is it? Is it the kidney causing the pressure? Is it the pressure causing the kidney? But by and large, because people are young, we believe that it's actually maybe the high blood pressure that is largely driving the kidney disease. Okay. But you could take me on that. The third cause of kidney disease is actually infections. In Uganda, the commonest cause of kidney disease we currently have depends on age largely. For children, it is malaria, diarrheal diseases, and other things that cause kidney injury, which is acute then becomes chronic. But diseases like HIV and infections, like infections of the sore throat, like streptococcal infections, those really cause chronic kidney disease, and others where people have bilharzia, schistosomiasis, and other common infections really cause kidney disease. Then, drugs. A lot of people take many drugs, particularly painkillers, antibiotics, and mainly what we call over-the-counter medication, which is not prescribed by the doctors, and some of the local herbs also, these traditional medicines we use. Those have caused a lot of havoc to the kidneys, and they usually do it slowly, that you don't notice, but they can be a big cause of kidney disease. Dr. Kalisula,
everyone believes that herbs are natural, and they have no problem.
So usually when you take herbs, even most of the drugs we have, they come from herbs. But it largely depends on what is in those herbs. Most times the herbs are not given in the right dose, and so they overwhelm the kidney. And once the kidney is overwhelmed, then it becomes damaged. That's what usually happens.
Because you may not know exactly what is contained in this cardamom.
Yeah, true.
They tell you take 5 liters a day.
Yes.
Okay, anything else?
So the other causes of kidney disease could be when you have, largely depends on children. The children, they can be born with abnormal kidneys. They could be born with one kidney. They could be born with abnormalities in that system we talked about at the beginning, and so they could get kidney disease. But by and large, adults can also get kidney disease when they don't drink enough water, and they form what we call kidney stones.
Dr. Kalisula, there are people who cannot drink water. What can they drink?
They drink other things,
not
except alcohol.
Okay.
Yes. So anyway, we call it fluids. You should make sure you drink something. Take tea. Don't take too much milk tea, but at least take juice. Sodas are not very good, as we know, but try to take some healthy drink. So that at least you are able to take 1 to 2 liters a day.
Hypertension causing kidney disease. Kidney disease causing hypertension. Chicken and egg.
Chicken and egg.
But looks like in Uganda it's more of the egg.
It's more of the egg, yes.
Because you're saying commonly we see people with hypertension getting kidney diseases.
Getting kidney diseases, yes.
How does one make a diagnosis of kidney disease, Dr. Kalisula?
So the diagnosis of kidney disease, as I said, because it most times presents with no symptoms, the best diagnosis is made by taking a blood sample and by taking a urine sample. When we take that urine sample, we are able to know whether there is too much in the urine that is not supposed to be there. Normally, the kidney filters everything and keeps it, apart from the toxic products like urea. But now, if you look at the urine and you find particularly proteins, or you find bacteria, or you find other products that are not supposed to be there, then you can know that this person has an abnormality of the kidney.
So would you encourage people to routinely go for such tests?
Definitely. If you are 30 years and above, you should go to check your kidneys at least once every year. And you can do just a urine check. But the major one which tells you how well your kidney is functioning is what is a component we call creatinine. That creatinine comes as a breakdown of muscles, and it's something we can measure in the blood. And with it, we are able to tell you how well your kidney is functioning. So using a creatinine and a urine sample, we are able to tell you how well your kidney is functioning. But if there are any abnormalities, we can actually scan your kidneys. With a scan, when we know that there is a problem, we can know you have 2 kidneys, you have 1 kidney, there is a stone, there is some abnormality along the system. We can do imaging.
Okay.
Yes.
You talk about a person having 2 kidneys. When you have kidney failure, which one goes first? Like if one kidney is functional and then the other one is not, is that kidney failure or not?
No. If actually one kidney is functioning, you can have maybe some mild kidney dysfunction. But unfortunately, most of the diseases I talked about above, except kidney stones or injury trauma, most of them affect both kidneys. And that's where the problem is.
Not that one is okay, the other one is not okay.
Very rare is one okay, unless you have a cancer, a tumor, or an obstruction, or a stone, which will affect one kidney. Normally, both kidneys are affected.
And again, the issue is, we worry about kidney diseases. Are there any complications that should make us worry about having kidney disease, Dr. Kalisule?
So really, the complications of kidney disease are very worrying. Because, as I told you, usually the extreme is when you lose your level of consciousness. Some people have gone to Butabika because of kidney disease.
Why?
Because the toxins, urea goes to your head and you begin convulsing, you say things which are not there, and then you might actually end up in Butabika. But by and large, every part of the body can be affected by the kidney. The major organs affected are the heart.
Okay.
The heart, through generation of blood pressure, you can get heart attack, you can get abnormal presentations, chest pain, and all those other problems. You can affect the lungs. If the water does not come out, for instance, it can accumulate in your lungs and cause a lot of difficulty in breathing. It can affect the intestines. If the water does not come out or the toxin go to your gut, you are unable to absorb food well, so you begin vomiting, you begin developing other problems. It can actually affect any part of the body.
You told us it makes blood.
Yes.
So you can lose blood?
You can actually present with the anemia, which is low blood level. That's a very common presentation. Someone thinks that bamusindikidde amayembe edda. Before we could diagnose kidney disease, abantu bafiiranga eyo mu kyalo. They used to die in the villages when they got that anemia, and they say something is a problem. So the kidney is very important, and some people also present with fractures. If the calcium balance is not done well, you get what is called the osteodystrophy or bone mineral disease, and someone can actually present with a fracture.
Small injury, you get a fracture.
You get a fracture.
That can be so scary.
Yes, sure.
And then blood pressure, stroke can come in kidney disease.
Stroke can come in kidney disease. You can get things coming from blood pressure can be vast, and you can get a heart attack from the kidney disease. Then also you can get acid-base imbalance, where you get difficulty in breathing and all the body tissues begin to die. So many complications can actually come out of the kidney.
We are discussing kidneys, and actually kidney disease can have so many complications. Dr. Kalisule is the expert. Is there any treatment for this?
So the best treatment is the 8 golden rules we discussed about from the World Kidney Foundation. But by and large, if you are very sick, let's say your kidneys are functioning less than 60%, then there we can begin you on drugs. You can take drugs. The main treatment is actually controlling the blood pressure, ensuring it is in normal range. The other treatment is if it was caused by diabetes, you control the diabetes. If it's an infection, you control the infection. But there are drugs that directly target the kidney. We have drugs like that help to balance the salts. We have drugs that help you to make more blood, like injections or tablets of erythropoietin. We have drugs that help to bring out much water in you. They are called diuretics. So
they make you
pee a bit
more than
so they force the kidney to pass out the urine. There are drugs that just help to maintain the kidney function itself. But if it was caused by a stone, the stone can be removed. If it caused by a urinary tract infection, it can be treated. And then if you fail, like if you go to below 15% end-stage renal disease, there are renal replacement therapies, as we call them, and the major one is actually dialysis.
Tell us about that. What is dialysis?
So dialysis is actually like an artificial kidney. You take the blood out using some mechanism, usually a catheter, and then you take that blood to a machine. There's what we call hemodialysis, cleaning the blood directly. That machine then cleans the blood, and we give it back to it.
So they wash my blood, or they wash your blood
Yes.
through a machine, then the blood goes back into you.
Then the blood goes back into you. That's dialysis.
Is that available in Uganda?
It is available in Uganda. The other way is what we call peritoneal dialysis. They use some fluids, they put them in your stomach, in your tummy, not stomach actually, your tummy, peritoneum, and then it does the same work. It cleans, and then that fluid is taken out through a tube again. The last and most important one is a kidney transplant. Some people can be given a kidney transplant to have a lease of life. I should say that the major challenge with these treatments is that they are largely inaccessible. Dialysis is only available in Kampala and in Mbarara, and it's very expensive. It ranges from about 300,000 to 1.5 million per week.
300 to 1.5 million per week.
Per week, yes.
And for how many weeks? How long is the dose?
The dose, you need it 3 times a week, and if your kidneys are totally dead, you need it for the rest of your life, or until you are able to get a kidney transplant. So we know that about only 1% of the people who need dialysis are able to afford it.
1%?
So if you see 100 people, 99 will die, and probably 1% will survive. That's why we are here.
What makes it so expensive?
What makes it expensive is the things that are used to do dialysis.
The consumables.
The consumables. In order for you to do dialysis, you need about 200 to 300 liters of water. And this is not normal water, it is purified water. And in that water, you have to put their compounds, which is called the dialysate. It has to be there to remove the compounds, and then you have to use that artificial kidney, which is called the dialyzer. So all those...
That is the machine?
Not the machine itself. It is the tube which is put in the machine to run. Then the machine itself, that machine is bought once, but these consumables you have to use to do the cleaning, and they are not used again. So each time they use a different set. So those make the cost of dialysis go up.
How about transplant? You say we have dialysis. Do you have transplant in Uganda?
We unfortunately do not have kidney transplant in Uganda, but we are working very hard on it. We have actually a committee headed by several doctors, that Dr. Simo is in charge of it, and we have been working at this for the last 5 years. We have even taken the bill to Parliament to allow us to do kidney transplant, and the Mulago Hospital, the director of Mulago and the management have allocated to us the whole 6th floor, which is going to be the future transplant center. But for now, we are not able to do it. And the transplant is very expensive. Mainly we do them in India, Kenya, and South Africa, and they cost between 100 and 150 million to have a kidney transplant done.
Uganda shillings?
Ugandan shillings.
And what's the success rate?
The success rate for transplant, actually, if you get the right donor, is quite good.
This is interesting. Dialysis is very expensive.
Yes.
When it comes to transplant, it's even more expensive.
You are right, Doc. And that's depressing.
Dr. Kalisulu, how does one prevent this?
So the prevention is actually the 8 golden rules we saw.
I think you need to take through us.
So the major thing is make sure if your kidneys are working well or you are still healthy, take enough water. A healthy person should take, maybe if I say water, I'm saying take enough fluids.
Let's use water.
Okay, take enough water.
Those who can drink water will drink something else.
Okay, so you can take 1 to 2 liters. You should take at least 1 to 2 liters every day if you are above 18 years.
Okay.
Okay?
1 to 2 liters.
Yes. So water is life, and it's more so for the kidneys. People say water is life if you don't live in Wise.
In somewhere, okay.
So water, taking enough water. The next thing is a healthy diet. This healthy diet really consists largely of fruits, okay? You should make sure you have enough fruits in your diet. You should make sure you take little salt. Don't take too much salt. Take just salt to give you taste, because salt is one of the major causes
Of
of
hypertension.
high blood pressure,
And high blood pressure is one of the main causes.
of kidney disease,
kidney
especially
disease.
in Uganda.
Mhm.
Yes. If you have diabetes,
Mhm.
make sure that it is treated, because it's among the commonest causes of kidney disease. Then the third thing is do exercise. When you do exercise, every part of the body actually benefits. And what do we mean when we talk about exercise? When we talk about exercise, most people think you should go to the gym, you should do all these things. Sauna, go and have that. Well, exercise is actually making sure that you exert your body to some level. And it can be, depending on your level, it can be by walking. We require that you walk a minimum of 30 minutes to 1 hour, 4 times a week.
You said 1 hour
Yeah,
of walking,
of walking,
brisk walking.
brisk walking, or walking even normally, but at least purposeful walking, not that you walk 5 minutes, then you walk. So this should be usually continuous, so that the heart gets trained, so that the blood supply, you sweat a little, so that is well. You can do other exercises, swimming, playing soccer, basketball, riding a bike, any of those things that are going to bring you to do exercise. So exercise is another major part of preventing kidney disease, just like all other non-communicable diseases.
Okay.
That's key. Then the other way we can actually prevent kidney disease is avoiding unscrupulous use of drugs.
What do you mean, drugs? Cocaine?
No, drugs, medicines.
Oh, like the over-the-counter.
Even doctors, even drugs given to you by the doctors,
Okay.
they can actually cause kidney damage. So whenever you are taking drugs, ask your doctor or ask the health worker or the pharmacist, is this drug safe for my kidney? If it is not, then
There is an
you should
epidemic
probably
of
not take it.
infections.
Yes.
Everyone has an infection these days,
Yeah.
and they're given antibiotics.
They are given antibiotics. Some of the antibiotics actually knock down the kidney. And so you need to be careful when you are taking these drugs. The other
You
way
talked about painkillers.
Painkillers in particular cause damage to kidney disease if you use them for long, because they can damage the blood vessels, but they can also damage any part of the kidney actually. So if you take them for long, they actually cause very much damage to the kidney. Except the safe drug is usually Panadol, but most of the other painkillers can actually cause some
You know,
kind
these
of
things are
damage.
interesting.
Mm.
When a liver specialist comes in and then talk about paracetamol, they'll also say, oh my God,
No, but actually paracetamol doesn't damage the kidney if you take it in the right doses.
it is good.
Yeah.
Okay.
Unless your liver is already sick, then paracetamol. But you know you have to take 10 tablets of paracetamol to damage your
Damage
liver.
the liver,
But if you
okay.
take them normally, they are not likely to damage your
But I
liver.
think, as you've said, it's always good to avoid.
Avoid
these
just
medicines.
taking the medicines without a very important
And these days,
indication.
you know, people go and consult their doctors
Mm.
online,
Mm.
and they go and get the most expensive medicine,
Yeah.
and they use that.
Mm.
About drinking alcohol and the kidneys, how are they?
So alcohol can actually cause kidney disease directly or indirectly through damaging other parts of the body, largely affecting the heart. You remember part of the blood comes from the heart. It can also cause direct damage to the kidney, particularly for people who get stones. That's
Kidney
when we worry.
stones.
Yeah, kidney stones. Alcohol can actually accelerate the formation of kidney stones, and actually alcohol can also damage your liver, which might in turn also cause your kidney to be damaged. So alcohol, people always say alcohol, it should be taken in moderation. But if it is taken too much, it can damage other organs, but it can also damage the kidney directly.
And be better not to take it. How about
It is
smoking?
best not to take it. Smoking is also dangerous for the kidney. As I told you, the kidney is made up of very small blood vessels. And now nicotine is a major cause of damage to those small blood vessels.
Makes them even smaller.
It makes them smaller, which we call atherosclerosis. So they are small and they are rigid. So they are not able to accommodate the pressure when it comes. So actually, smoking can damage the kidneys directly, or it can damage it by causing cancers you know you're a cancer specialist. So it can actually cause cancers in different parts of the body, but it can also increase what we call the kidney cancer, renal cell carcinoma, which is a major problem. It sometimes also is associated with the increasing just the damage to the glomerulus.
Wow, Dr. Kalisula, we are coming to the top of the hour, which means we are getting to the end of our kidney disease talk. What are your winding up remarks?
So I think my winding up remarks would be, number one, know the status of your kidneys.
How?
Go to the doctor and have a health check. If you are 30 years and above, make sure at least once every year, at least you do a urine check or you do a creatinine check, number one. If you are diabetic, hypertensive, have HIV, or have chronic infection, chronic pain, and are taking painkillers, you should have your kidney checked at least once every year, just to be sure. And the problem is that always ask your doctor, is my kidney working? Because just finding an abnormality in the creatinine might not be able to tell the doctor. The doctor needs to calculate your glomerular filtration rate, and it tells your kidney is working 80%. Your kidney is working 60%. He's able to do that. We have many apps for that. When you visit the health work, make sure you ask them how well your kidney is working. And besides that, you should do exercise, eat healthy, and of course, make sure that you avoid drugs that damage the kidney.
Well, thank you very much, Dr. Kalisula, and thank you all who have been part of this program. Every Thursday, we discuss health topics here at UBC TV, and the program is UHealth Chat. I am Dr. Dungu. I'll always come back with more topics that are of interest to you. Until next Thursday, when we shall have another interesting topic, make sure you remain watching UBC News. And tonight, what is coming up next is UBC Tonight by Patricia. See you next Thursday.
Was brought to you by
UHealth Chat is brought to you by National Medical Stores, who are mandated to procure, store, distribute essential medicines and medical supplies to all public health facilities in the country.